Hey everybody, it's Dr. Galvin. Sorry I have not posted in a little bit. Had a lot going on, and the COVID numbers have been muted. We are having decreased numbers of cases. I worked in the ER this past weekend and really saw a few COVID cases, not much. I don't think we admitted a single COVID case, at least not in the nights I worked this particular weekend. So that's good news. The cases are rising in the U.S. I think they're up about 20% in the last couple weeks because we have these couple new variants of this BA2 variant, which are much more contagious. But we have such a large percentage of people that have either been infected or are vaccinated, and a lot of them are both, that there's a lot of protection out there from these variants. One of the problems with dropping mask mandates and things like that is that we're going to see more variants, because what's going to happen, we're going to get intercombination of variants. We've already got some new variants that are actually combinations of existing variants, and the more transmission and the more people are kind of not distancing and masking and things like that, the more chance for these other mutations to occur. So we're going to see those. I'm hopeful that we're through the worst of it and we won't see another big surge, because again, once we're protected from those from the overall COVID virus, that coronavirus, once we've seen that, our body's got some information on how to fight it, and generally the vaccinations and prior infections are pretty protective, and especially if you've had both, been vaccinated and prior infection. One interesting story I read today was about a new drug that just came through a double-blind clinical trial called, if I can say it, sabizabulin. And that had a very interesting study course. They had to stop the study early, not because it didn't work, as we've had some studies ending, but actually because it worked so well. It worked so well, and the people that got it did so much better than the people that didn't get it, that they had to stop the study early because it was unethical to give the placebo group something that didn't work as well as this drug. And it's a combination of both an antiviral and an anti-inflammatory, so it kind of hits both of the big problems, both fights viral replication and also fights the effect of the virus on that inflammatory cascade that causes really sick people to get really sick. And this was actually done for moderately to severe hospitalized patients, and it looks like the mortality rate in the placebo group, meaning the group that did not realize they were not getting the real medicine, was 45%. The mortality rate in the moderate to severe COVID patients in the hospital that got the drug was only 20%. So they felt it was unethical to continue with that study when they were getting such good results. And I don't know when that's going to be out. Hopefully it'll get emergency use authorization fairly soon, and we'll be able to get it out to people. I've got a new person who works for my clinic who's very media savvy, so we're going to start putting out more content that has to do with health, because one of the best ways to protect yourself from COVID is to get healthy, lose weight, get fit, get enough sleep. All these things, we're seeing that those people that have been able to do that through COVID, and many people have not been able to do that through the pandemic, have done much better. So we're going to be focusing a lot more content on health and wellness, which is my passion anyway. But I will continue to do these updates as things change. Everybody stay safe, have a good day, and I'll talk to you soon. I'm Dr. Galvin. For those of you that don't know me, I'm a board-certified emergency medicine doctor. I've been doing these videos for quite some time. Please follow us and like us if you find these videos helpful. Have a good one.